I'm Heather at Fundamental Foot Care. I'm the owner, and I got the idea to start Fundamental Foot Care when I was a bedside nurse on a med-surg unit. And I took care of people before and after amputations, and when they had cellulitis that they were trying to clean up, people with vascular issues. And I felt that there was a role that preventive foot care needed to play so that we could prevent some of these illnesses that people had. Because what I found was diabetic amputations are largely preventable. And so my goal in starting Fundamental Foot Care was to normalize routine foot care for folks and help them to understand the benefits of routine foot care and, the importance of foot care to day-to-day mobility and well-being. Because once you lose your mobility, your well-being and your physical health suffers. Our bodies are made to move in order for our body's organs to work properly. And so when I found that there was a specialty of sorts that nurses could train for and get nationally certified, I was all over it. And I thought if I paid for it out of my own money and no employer paid for it for me, there'd be no strings attached and I could start my own business. Part of the benefit of that was I couldn't see myself working 12 and 14-hour shifts into my 60s. It was tiring. I loved patient care. That's why I got into nursing, is for the patient care, for the compassion, for the people skills. In fact, as I talk about it now, it gives me goosebumps. And I love the connection with people, and particularly with our older adult population. They deserve our respect, and they deserve being treated with dignity, not rushed through and herded like cattle. And our current healthcare system just doesn't recognize their value. At Fundamental Foot Care, we recognize patients' value and their interest in staying mobile and doing what they want to do. They deserve to do that. And if they are cared for, they can continue to do the things they want to do and remain healthy and mobile for as long as possible. I didn't realize how overlooked foot care was until I started investigating the whole certification process. And what I found in my research is that it was easier to find care for our dog's nails than it was for our loved one's nails. And I was kind of mortified, honestly. And so my effort in building Fundamental Foot Care is to normalize the fact that we need to take care of our feet. In fact, in one's overall lifetime, say an average of 80 years, the average person walks 4 to 5 times around the circumference of the earth. And the care of our feet is not prioritized by medical professionals in general unless you're having a problem with your feet. And chances are you've waited too long, you've put it off, and then you're seeking help from a medical professional when it's very serious. The services we provide at Fundamental Foot Care are, well, first of all, I want to tell you that we are all registered nurses with many years of experience in a variety of areas of nursing. And we provide nursing assessments of the lower legs, the feet, the nails. We're able to notice signs and symptoms of issues before they become serious issues. We can note things that are risk for infection. We trim toenails. We take care of reducing calluses and corns. We can take care of most ingrown toenails as long as they're not red and inflamed and infected. If something is beyond our scope of practice, we encourage you and make a referral to go to the proper medical professional that can take care of it for you. And we know that getting appointments on a timely basis is very difficult in our area, and so we try to help facilitate care for you. We provide the care in our clinic here at 735 Maine Road North in Hamden. We have 3 private treatment rooms, and we also have a low-cost clinic that we hold 4 times a year, and we also go into private homes and elder facilities around the area. Our scheduling process is very simple. All you have to do is call our office at 207-991-0141 and reach out to Rhonda. And the other way you can schedule an appointment is to email us at info@fundamentalfootcare.com, and Rhonda will get back to you and schedule an appointment. In general, we can get you in within a couple of weeks. Not long months of waiting. Our schedule is generally pretty flexible, and we also have membership options, which are an opportunity to save some money, or you can do one appointment at a time. We found memberships to be an important model to implement. One, because we're trying to really stress the importance of routine preventive care. And in general, it's important for people to see us every 8 to 10 weeks. And you can see us more often. We do have memberships that are more often. But for instance, if you were to schedule a standalone appointment without the membership, it would be $150 here in the clinic. And if you signed up for the membership, where you would see us 6 times a year or every other month, you would average paying $125 a visit. So it's a pretty significant savings. The way we are different from a salon or a podiatrist, at a salon you get a nail tech, and they generally provide a pedicure, soak your feet, do nail polish, and it's for the aesthetics, how you look. At Fundamental Foot Care, we approach it from a medical standpoint, and it's for your physical health and your comfort. And so on your first visit, We'll do a nursing assessment of your lower legs, your feet and your nails. We'll trim your toenails. We'll reduce your calluses, corns if you have them. We can relieve the pain of most ingrown toenails. We also offer patient education on ways that you can help yourself at home, why you might be experiencing certain symptoms, or why you're getting the calluses in a certain place. We'll look at your shoes to see if your shoes are appropriate. And when we're done, we will end the appointment by applying moisturizing lotion and giving you a brief, very relaxing foot and lower leg massage, and that's always everybody's favorite. Fundamental foot care is different in the care it provides from podiatrists, in that generally when you go to a podiatrist, they allow you 10 or 15 minutes max, and they clip your toenails. Don't generally offer a lot of patient education, and don't help you with your socks and shoes. At Fundamental Foot Care, we allow 40 minutes here in the clinic, 40 minutes if we're doing an appointment at a facility. Private homes, we allow an hour, and at the low-cost clinic, we also allow an hour. So that allows our nurses to be very thorough in our care. At Fundamental Foot Care, I think that the most important thing for patients and their caregivers or family members to hear is that we care about their loved ones. We care about patients. And not only do we care about them and offer them compassionate care, we have medical background to back up what we're doing. We do evidence-based care, and we will not rush you. And if you have any question, if we don't know the answer, we will certainly find it, and we'll ensure the very best care that you can receive.